Appreciate everybody coming out this morning. I'm Terrell, Estes, Chairman of the Marion County Commission. We had a special call meeting this morning. We've extended the curfew through April the 30th. It will carry on through April the 30th unless the governor makes different announcements. We will do whatever the governor and the state does. Again, appreciate everybody coming out. It's a bad time in Marion County. It's a bad time in the whole state and the United States, the whole world. Just ask everybody to pray that we can get through all of this and not lose more lives than what we've lost. Our numbers are climbing daily on people with the virus and deaths. It's just a bad situation. At this time, I'd like to introduce Probate Judge Paige Vick. She will have some more comments on this.
Good morning. I'm going to try to speak loudly because I understand there's traffic out here. On March the 30th of 2020, under the powers vested to me by the Code of Alabama, I entered into a quarantine order effective until tomorrow, April the 17th, 2020 at 5 o'clock. Now, the decision to enter that order was made after hours of meetings with our EMA director, our county commission chairman, and our county attorney. Now, during those meetings, we discussed the quickly evolving situation we have in Marion County with COVID-19 as it was relayed to us from the Alabama Department of Public Health. I found at that time that the facts were such that the quarantine request that had been asked of me was necessary to be granted. I made 4 specific findings. First, the COVID-19 pandemic, as defined by the World Health Organization, was a serious hazard to Marion County, Alabama. 2, the multiple positive tests that we were receiving and the rate at which we were receiving them indicated an immediate danger to the lives of Marion County. 3rd, the impact of the COVID-19 was going to adversely affect the health, the safety, and the economy of Marion County. A continued outbreak of COVID-CD would be beyond the control of what we can provide with our services, our personnel, and our facilities that we have here in Marion County. Today, April the 16th, 2020, after a very lengthy scrutiny of the facts and data that have been provided to us by the Alabama Department of Public Health, I find that the original reasons behind me granting that original quarantine request still exist in Marion County. Our numbers are still rising since that original order was signed, and we cannot let up. Therefore, I'm granting the request to extend that quarantine order until April the 30th, 2020 at 5 o'clock. Now, with that being said, we are going to continually monitor the situation and speak daily with the Alabama Department of Public Health. And if prior to the 30th of April, Alabama Department of Public Health gives us the all clear to lift this quarantine, it will be lifted. We are ready to get back to our normal lives in Marion County. We are ready for our businesses, our small business owners, to be back in business. This is causing a terrible economic effect on them, but it's going to take all of us working together. So we, the Marion County Commission, the EMA Director, and I, stand here before you as a united front. We want to stop the spread of this invisible enemy in our county, and we ask that you respect each other. Practice social distancing seriously. Try not to take the entire family when you go shopping. one person should suffice. If a household member tests positive for the COVID-19, please adhere to the Alabama Department of Public Health's mandates on self-quarantine. We're ready. We've got to work together, Marion County, together as a county, to stop this virus from spreading. Let's show the rest of the state that Marion County will pull together and do what it takes to get us back to normalcy. At this time, I would like to introduce to you our Marion County EMA Director, Terrell, who has some information to fill you in with some numbers. Eric?
Good morning, everybody. Real quick, I want to talk to you about the numbers and a little bit of the history behind the decision-making process that was used to put these orders that we have in Marion County in place. Our county commission, the sheriff, Judge Bird, there's been several people, the probate judge, several people have put a lot of time and effort and thought and prayer into these orders, and nothing was done in haste. So, starting on March the 21st, we had our first positive case in Marion County. That day, the commission came together and they voted to put Marion County under a state of emergency. Shortly after that, on March the 30th, we were up to 10 cases and already had 1 death in our county. At that time, they thought it was time to do something different and try to help get ahead of the curve, try to help do something in our county to help control this as much as possible. Since then, we've risen to 58 cases. Just this past weekend, our case count went up by 20. We've heard, sometimes our public wants to know why is Marion County doing something different? Why are we doing things that the counties around us aren't doing? This morning I looked up the numbers, and 4 of the counties around us combined have a total of 35 cases. Marion County has over 23 cases more than the 4 counties that surround us. So it's a serious problem here in our county, and we're trying to do what we can do to get ahead of it and help protect our citizens. With that said, Dr. Landry is, is the Assistant State Health Officer for Alabama, and she's here to speak for a few minutes. She'll be followed by Dr. Keri Merschman from the North Mississippi Medical Center, and following that, we'll have questions.
Thank you, Eric, Chairman, Judge, and all of the members of the community who are here. I have a few moments to speak to Dr. Merschman regarding what's being done here in Marion County. I work for the State Health Department. I am a physician. I am a career public health officer. I have been with the State Health Department for 38 years. And as I said a few weeks ago in one of the counties, this is really something that public health has planned and trained for many years for these kinds of situations, hoping that they never come, but they do, and it has, and it's here. And as a result of this, we have to respond in like manner, and we have to take the position that this is a serious and deadly virus for which we still have the power as individuals, we still have the power as physicians and healthcare workers, we still have the powers as a public health entity and as a community to strike back at this virus. But our ways to do that are really what we're doing at the moment. As I've said several times in talking with the media, the general public, and other entities, that I have a prescription for this virus, and our prescription is social distancing, staying at home unless you have to be out, and if you have essential work that you have to do, practicing the preventive measures in that workplace in order to reduce the spread of this virus. Now, this has been very drastic, and it continues to be very drastic, and people are now getting a bit restless as we have seen our numbers in Alabama rise, but we also have seen perhaps a bit less rise than many of us were fearful would happen. So now people are restless and they say, well, let's go back to doing this and let's go back to doing that. Frankly, as a physician, I'm asking people to please follow my prescription. Please follow the prescription of the Alabama Department of Public Health. Please follow the direction of the healthcare community on this until such time as we can see that we continue to level out or decrease in this. Now, speaking to what this virus is all about, I want to just take a minute to remind that this is a respiratory droplet virus. We are learning more about this virus every day, but this is a respiratory droplet virus. So if we take the measures of social distancing, again, I've had people say, well, I read something that said this virus could spread further than 6 feet. Well, again, in one particular laboratory instance that was shown with certain environmental parameters within that lab. But if we look generally at the information, it appears that the 6-foot distance is reasonable. It also appears that the length of time of exposure should be about 15 minutes of consistent time within that 6-foot distance to spread this virus. It is respiratory droplets, so it's spread person to person. And by that I mean from being close to that person, talking forcefully, coughing, sneezing. These are the primary ways that this virus is spread. I've been asked about surfaces. So again, surfaces, yes, while the virus can live on a surface, we do not think that that is nearly as efficient a way as person to person. So, I've just told you 2 things that we also have a way to reduce. And one is that if it's spread person to person, and if we social distance, and if we stay apart, then we're going to reduce that spread. And then surfaces. How can we reduce the risk from surfaces? Well, we can keep those surfaces clean and use standard household type products approved by the EPA. This is all on CDC's website and also on the Alabama Department of Public Health, alabamapublichealth.gov. These are the ways we can reduce the risk of this virus. Now, I have a personal connection to this virus. I'm over 65. I'm a healthcare worker. My daughter is an emergency doctor. So what I urge people to do in order to keep our healthcare workers working, in order to keep our community leaders where they can carry out the functions of government, in order to keep our fire and our police and our EMS and the essential people working for the health and well-being of the community, to continue to follow the state health officer's orders so that by staying apart, we will be able, as the judge said, to come together when the time is right. But again, let's continue to do the measures that appear to be having some effect in order to get this county, the state of Alabama, and the nation back on track. Thank you.
Thank you so much for letting me come and speak today. I'm truly honored to be here representing our local hospital and clinic system. I wanted to take this opportunity to just thank our healthcare workers who are showing up every day, giving their best, and who are even filling the gap in places where they don't normally serve. We are asking healthcare workers to do things that they maybe haven't done before, and they have risen to that challenge because they care about their community. These are definitely difficult times. We are all in a place that we have never been, physically, emotionally, and financially. We are facing a virus that, until recently, no one had ever seen. It has changed how we work, how we worship, and how we interact together. The most common question I get frequently is about our numbers. How many people have been affected? In all honesty, to me, the numbers are only one part of the greater issue. In medicine, our goal is to treat each and every patient, not their labs, not their numbers. We treat the patient. COVID-19 is no different from that. We cannot let ourselves get distracted with the numbers because they only show what we already know. Our entire state of Alabama, our county, and our greater nation have been affected. So many are asking about returning to work and reopening our economy. This is a very delicate issue right now, but I want to remind everyone that in Alabama, we are still fighting this fight. When we turn on our television and watch the major news channels based out of New York or Washington, D.C., things seem to be improving. However, we have to remember that our country is large, and our region has an additional lag compared to those northern cities. Our peak here in Alabama has not yet come, and will not be here for probably another 5 to 7 days, according to the latest numbers. I encourage you for now to please support your government officials as they make very difficult decisions in trying to keep you and your family safe, me and my family safe. A top infectious disease physician in Chicago recommended that people save the world by staying home and watching Netflix. I would like to add to that. There are plenty of activities that you can do that don't involve screen time, help you stay safe, and practice social distancing. Have we thought about taking our children fishing for the first time, coloring with them, playing a board game as a family, or going on a walk and enjoying this beautiful Alabama sunshine? Those are all things that can be done in the safety of our homes and our own environments without risking our health or that of others. Even taking a picnic, as my own children like to do. Most of all, during this challenging time, let us remember to have grace on one another and our community leaders as we figure out how to get through this together. As always, we are here for you and your families to help guide you through this challenging time.
Thank y'all. At this time, we'll take time for a few questions. If anybody has anything they'd like to ask anybody that spoke today.
I want to know why a small business can't open when the liquor stores, Walmart's open, Tractor Supply, co-op, dollar stores,
Yes, sir.
and we could be selling clothes too, just like them.
Yes, sir. I'm going to let the probate judge handle that question. I'll just hand that over.
You can't even go to church, but they Walmart be open. That's why it's spreading so.
And I don't disagree with you, Mr. Thompson. That mandate about what are essential businesses or non-essential business did not arise from any of the orders that came out of Marion County. That was a decision made at a state level, and it is definitely impacting the economy of America, and I totally agree. If you're not being able to sell clothes, neither should some of the other businesses that just happen to have essential items. But that was a decision made outside of those.
That's not right for liquor stores. Not here. You can't go to church.
And I don't.
Walmart's full down there all the time.
And I don't disagree with you. And it's taken a lot of people having to modify, whether it be your church. We all had to modify Easter, and we've never experienced an Easter like that before.
But if
Again,
you
those
want to
decisions.
close it down, close all the stores down, you'll put having that congregate.
And that's something that may need to go to Montgomery, who has that ability to make that decision. That's outside the decision-making power we have here in Marion County.
I talked to Larry Stubbs about it too.
Yes.
I'd like to take the opportunity to thank all of you that came here today, especially our medical field, and thank you for what you guys are doing right now. You're certainly under the gun. But Eric, I just want to know quickly, are we doing anything to stockpile maybe the proper masks and maybe the ventilators and stuff in Marion County, not talking about, these outside places? What are we doing right now in case this thing really jumps in this area?
Yes, sir. I speak to the hospital administrators daily. I spoke with Mr. Terrell down at North Mississippi this morning. He's got a plan. If we do see a surge, he's already got a plan in place. Also, Mr. Wyndham down at Winfield this morning, I spoke to him. They've already started breaking ground or doing whatever they have to do to build a COVID-19 wing where they're going to be able to support, I think he said up to 5 people on ventilators. So they're working on that. Our local hospitals are working on being able to handle a surge. We do have a surge of patients that get ventilators. As far as the mask, ADPH and the state has been pushing us masks since sometime the middle part of March. I push those out to all of our first responders, our local nursing homes, and our hospitals. So we do have masks that we're pushing out to help those people have the proper PPE. Yes, sir. Anybody else?
Are there any concerns about maybe a second wave? Are you guys prepared for that at all?
Other than what we just talked about with the ventilators, the hospitals are preparing. I'm sure Mr. Merschman can tell you a little bit about what they're doing down here in Hamilton, what they're doing at Winfield, you know, preparing the wing and that kind of thing. Our state ADPH is still pushing those supplies. They're ordering the supplies. Of course, you know, if you watch the news, a lot of that PPE stuff's hard to come by right now because everybody in the world is trying to get their hands on it. But ADPH is doing a great job of trying to get those supplies on hand and get them pushed out here to the counties where we need them.
If you don't mind,
Yes,
I'd
ma'am.
like to address that also. So I had not even considered the idea of a second wave until really this morning when I was going over our numbers and looking at the attitudes of our community. I know there is a lot of struggle right now about everyone returning to work and getting back to normal. So I think right now, hopefully there will not be a second wave, but if we do not continue to practice the things that have already been shown to be helpful, the social distancing, the staying home, the wearing a cloth mask when you go to the grocery store, washing our hands frequently, all of those things are very significant in protecting our families and ourselves against this virus. And if we don't continue to do those things, then I do think a second wave is possible, but it's much too early to have any data at all about whether that's going to happen.
Yes,
Dr.
ma'am.
Merschman mentioned going fishing, going walking. I wondered what in the county is closed and what's open, like Marion County Lake or
Yes, ma'am.
things like that.
And that, again, that's in the order, the order that was published on the 30th of March. It pretty well outlines that. And I thought, you know, like it or not, the way that the governor closed certain businesses or not, but she put out a list of businesses that were closing. That's the way she handled that. If it wasn't on that list, it's open. So if you didn't see Marion County Lake on the list, it's open.
Well, and maybe it sounds silly, but when I talk about going fishing, I'm thinking about my backyard. So I didn't really think about those larger places that may be affected. And if people have access to those resources, I think that's a great thing for families to make new memories during this time. I mean, it's going to sound very strange, but if we could have chosen a time of year for this to happen, it's beautiful today. The sun is shining. So we've got to still look for that silver lining and for those little things that we can still do to be positive and enjoy things like that. Those simple things that are free and cost nothing, like fresh air and sunshine. I think we should make the most of that. And this is time that families have at home. Possibly being off work isn't always a good thing, but at least we have a little bit of extra time with our families right now. Not myself so much, but others, and I just encourage everyone to use that to make memories right now while they're out of school, because we've sort of got a little stop time right now, and let's look for those silver linings and how we can make the most of it with our families. That was my reference about just some other ideas, things that you can do.
Anybody else? All right. Thank y'all for coming.
Don't forget to like and subscribe to our YouTube channel at www.youtube.com/49 County News TV.